Planet Vero Studio is powered by the Nolan Group of Remax Associated Realty. MyNextHomeFinder.com.
Welcome to Treasure Coast Community Health. We have 8 locations to serve you better. Our staff is dedicated to help you and your family. Here's your host, Vicki Soulé.
And good afternoon and welcome to Community Conversations. As the promo intro says, I am the CEO of a very fine federally qualified health center. We employ about 285 people to cover our 8 centers and an administrative support staff. And so we are very much engaged in our community. And we would like to always bring you new information. So sometimes it is an event that's about to happen, like the Senior Expo. Sometimes it is about healthcare. And today, I've had the gracious idea, I guess, of asking Dr. Omar, one of our dentists, a fairly new dentist to our regime of well-positioned staff, to be with us today to talk about dentistry. So welcome, Dr. Omar.
Thanks for having me.
Well, he did confide this is his very first time on radio, so I assured him he'd do fine. So we're going to start with some real softball questions, low-hanging fruit. Tell us a little bit about how you decided to become a dentist.
Well, in college, I was pre-med, and I also worked as an EMT.
Oh.
And after so many calls of just seeing people not in great shape, it kind of wears on you a bit.
Mm-hmm.
So dentistry for me was the same challenges of like applying like sciences and critical thinking, but less of that life and death every day.
Yeah, but you definitely make a difference. I mean, I have seen so many people come in and say, I can't afford to fix my front teeth, so I used to be a server, but now I'm, cutting lawn or whatever. And so it really does make a difference.
Absolutely.
And that's what you want to talk to us about, is making a difference in your children and your own lives as well. So tell us why you think that this is an important topic. Because you kind of volunteered for it, kind of.
That's true. As far as children go, I think often you hear people come in when they're like in their 20s, 30s, 40s, 50s, and they said, I hate dentistry when I was a kid. I didn't come back for 20, 30 years, and now this is what I've got. And inevitably, you do see a lot of things going on, and I'm hoping that through this and other outreach opportunities, we can bridge that gap and make people not less afraid of us or less fearful of us.
Mm-hmm. And I know that fear is real and exists, but I have also observed, having been in the dental chair myself since I was about 3 years old, with terribly soft teeth, a lot of changes have taken place in terms of pain control within that dental environment.
Yeah, I think I'd say half my patients who are older have complained about as a kid I wasn't given like Novocaine or anesthesia. All they recall is the pain or the noise and the trauma of it. I think nowadays, hopefully, we're less scary and it's usually pretty painless.
Well, and so what I experienced with my grandson was that they put a little topical ointment on first before even giving the Novocaine. Is that common with adults as well?
It's pretty standard practice.
Okay.
Or we put it over your gums, so you shouldn't really feel the actual injection most of the time.
And it seems like the noise within the dental area is much less than it used to be.
Yeah, I think our instruments are less noisy. I think a long time ago they had those old belt hand pieces that were very loud as well. Now things have changed for the better, I think. People also bring in headphones as well, which is
pretty cool.
It helps.
Yeah, and no more spit sinks. I mean, that's really aging me.
Never had those before, so I wouldn't know.
So one of the things that we talked about was how young you advise bringing children in. And I've heard everything from 5 and up, but you actually gave me a pretty low number.
I'd say for every provider, it probably differs, but I think the younger the better, just because if you can come in with a child, even they're 2 or 3 years old, and I'm not going to find anything probably, but even I can just look in their mouth and just say, hey, good job with your brushing, it tends to lower that fear barrier. Maybe when they come back later as an adult or as a young adult, they're less apprehensive of the whole experience.
So let's talk about in between that 3-year-old and young adult, though. For many years, it was not a big deal to remove children's teeth because, after all, they're not their permanent teeth.
Mm-hmm.
So how has that philosophy changed?
Well, at least the way I was trained, it's that your baby teeth are meant for eating and also for maintaining the space for your bigger teeth to come in later. So if you start taking out teeth too young, they can lead to just like collapse or kind of crowding of people's teeth. And that's not really good for anybody.
Yeah, then they go into braces and all those other nasty things, right?
More expensive, more involved.
Okay.
If you can save teeth, I'm all for it.
So how do we save teeth with the youngest ones?
Well, ideally, brushing and flossing every day, and like over-the-counter mouthwashes, good diet, good oral hygiene. Beyond that, if we've gotten to the point of the cavity, then hopefully we're taking care of it earlier on, unless when it's just fully broken down or infected or that kind of thing.
So the routine now should be at least every 6 months for a cleaning and an exam?
I'd say that's pretty standard, yeah. Obviously, if you're higher risk or if you're at lower risk, that can vary, but typically around 6 months or so.
Okay. And so for the youngest ones, you mentioned brushing and flossing. I was unaware that until a child reaches kindergarten, first, second grade, they don't have the manual dexterity to really brush well themselves.
Well, I'm hoping they have either a sibling or a parent or a guardian who can assist with that, because unfortunately they do need help, as you said.
Okay. And then teenagers, young teens especially, as they start getting a little more freedom, a little more of their own decision making. Lunch doesn't come with milk; it comes with a soda. What, if anything, can we advise those kids?
I myself like soda. I like sweet foods as well. As long as you're brushing and flossing and have good home care every day, it's not that big of a problem. However, if you're going to drink like Mountain Dew, I'd maybe wait like 20 minutes and then brush afterwards there if you do that. And
is there a gum that will help? Because, honestly, I can remember middle school as a time of, I don't want to call it bullying, but a lot of cliques that are very judgmental. How's that? And so that would be the last place that I would want to carry a toothbrush. Okay. Mm-hmm. So are there gums or rinses or things that they could do? Just a bottle of water, something that would remove that sugar?
I'd never say no to bottled water. Like at Walmart or wherever you can grab just like xylitol chewing gum. It stimulates salivary flow, which can help reduce the risk of caries in some cases.
Okay.
Mouthwashes, I'm all for it. Beyond that, I mean,
it's kind of like you got to be responsible, right?
Yeah.
So we're going to take a short break, so have a word from our sponsor, and then we'll come back and we'll talk about some other things related to dentistry. Thank you.
Awesome.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of in-stock coastal furniture on the Treasure Coast. Dining and bedroom sets, occasional tables, sofas, sleeper sofas, love seats and chairs, including lots of slipcover styles from Universal Upholstery, Four Seasons, and Capri. We also have a gallery of Tommy Bahama and Lexington furniture designed for a relaxed approach to the finer things in life. And right now, all pictures, lamps, and accessories are half price. Sunshine Furniture, $12.95 US 1 in Vero Beach next to Planet Fitness. Visit our website at sunshinefurniturecasual.com and also visit our outlet and closeout store directly across the street.
Sunshine Furniture, the best in every way. Have a sunshine day. Sunshine Furniture, stop on in today and have a sunshine day.
Water service? Don't let your money go down the drain. Make sure to get a quote from Affordable Water. Many times, Affordable Water's original price is less than the competitor's discount price. Yes, Affordable Water really is affordable. Make sure to get a quote today, because you haven't gotten a quote until it's affordable. Affordable Water.
Call 589-7677 for your H2O. Call the Pure Water Pros. Affordable Water.
The new year
year is underway, and it's time to schedule your annual physical. This quick, comprehensive visit can uncover diabetes, high blood pressure, and even cancer, ultimately saving your life. Treasure Coast Community Health waives Medicare deductibles and offers a sliding fee scale discount, so everyone can afford to take care of their health. We can't fix what we don't know. Let's work together to make a healthier community. Call us today at 772-257-TCCH. We're a nonprofit. And welcome back to Community Conversations. I'm Vicki Soule, and if you're just joining us, today we're talking about good oral health, dentistry in particular, with one of our resident dentists. I'm sorry, not as in residency, but someone who's been a part of our dental crew for a while now, Dr. Omar. So I'm going to follow up on that commercial in terms of regular checkups. That commercial was intended for medical folks, but does not the same apply to dental?
Absolutely. Every 6 months, we want to see you to see how you're doing. It's nice to hopefully catch things before they get worse, like cavities or like gum disease, that kind of thing. We don't want to see you one day and then see you next year or next 20 years later and a lot worse, hopefully not. But.
Well, and we do have an emergency service, and you pointed out that oftentimes you'll take care of someone and recommend that they come back, and you don't see them again until their next emergency. What's the pitfall of that? I mean, it saves money. I'm just telling you what I hear.
That's the classic example of like a short-term versus a long-term problem. So
penny wise and pound foolish.
Yes, yeah. Exactly. So, I mean, for example, like say today I had a toothache and I went in for an appointment and got it addressed that one day. That appointment hopefully is not my last stop at the dental office. If I wait 10 years and come back with another toothache as well, it's just going to keep costing me more and more over time. If you come back every 6 months and we catch it when it's early and not quite painful, the fixes are usually cheap.
And so how does the cleaning, the recommended every 6 month cleaning, how does that factor into it? Can you skip that?
So can you or should you?
Okay,
like if I were to skip
if
I were to skip an appointment, I mean hopefully I wouldn't die from that, but it's harder to catch things when they're very small. So like a small cavity that you catch at a 6 month recall, that's usually pretty easy to fix. If you wait again like 10 years, 20 years for that checkup, that can turn into a pretty big infection. That's more complicated.
Good point. So if I understand correctly, when people want to come in for their cleaning, there's add-ons to that. You see the dentist who checks out your teeth, and are x-rays done every 6 months or annually?
So x-rays, that's really up to the provider, but typically it's based on your risk or factors that can make you more prone to cavities. So for example, if I brushed every day, I flossed every day, never had a cavity my entire life, I may not need x-rays as often as someone who has several infections, several problems going on. Okay. So on average, about every year or so, we do x-rays.
Okay. And the difference between standing up at the camera that swings around the pano and the individuals, how do dentists determine which of those is relevant to the individual?
So let's say you're a 17-year-old kid and you have your wisdom teeth that are causing pain in the back and they're impacted. It's hard to typically catch that full tooth in one of those little small pictures. That's why you take a Panorex or a Pano. Okay. The small pictures are more for seeing like small cavities or small problems around the roots of your teeth, but wisdom teeth are too far back to catch that.
Gotcha. Okay, so that's the combination. Do you get much pushback from individuals saying, I don't want to have x-rays done?
That's very common. I think the fear, as I understand it, is just because of the risk of exposure to radiation. There's costs as well. I think I read somewhere that the equivalent exposure of a dental x-ray is like 16 pictures. It's like 7 hours on an airplane, so it's compared to like Los Angeles.
That sounds pretty low risk. A lot of us fly.
I mean, yeah, I fly once in a while, so.
But it really gives you the advantage of seeing and then prioritizing which things should be addressed in what order.
Correct. And also, we don't typically order x-rays for fun. We do it because there's a reason behind it. And if we see something suspicious, we want to make sure we're not missing anything critical.
So if someone were to come in for the first time and they just wanted to have a cleaning. Is that okay?
Again, okay, I'd say it's not ideal because we want to make sure your teeth are okay. When you polish teeth or clean up all the food over the last few years between the teeth, that's important too, but we can't always see cavities or anything like that without doing a full exam.
Okay.
And cavities are also important.
And that's where the skill set and training between a hygienist and a dentist vary, I presume.
Experienced hygienists are actually very good at finding things as well, but they often want to have a dentist confirm all those findings. And also, it's not just cavities. There's also things like oral cancer screenings and that kind of thing as well.
Ah, good point, because we do have a number of seniors who are with dentures in our environment, and they tell me that there's absolutely no reason for them to see a dentist because they don't have any teeth anymore.
Correct. And they still have a tongue, they still have cheeks, they still have a throat, and those are areas where you can have other pathology besides cavities.
And most physicians in their 15-minute or 20 minutes with an individual at an annual medical exam don't usually have you open up your mouth and check that out.
If they're an ENT, maybe, but typically for your primary care provider, not always.
Okay. And that's a life-saving thing. I know of several people who had malignant jaw surgery, and had it not been detected when it was, they wouldn't be with us today. So those of you that are out there and wondering, please make an appointment. I don't think any dentist would consider that a waste of time because they can't drill on your false teeth.
That's true.
My grandson was just telling me about George Washington and how everyone said that he had wooden teeth. But of course, that was impossible because wood soaks up water and we drink water. And I'm like, okay, I got it. Never mind.
Smart kid, it sounds like.
Yeah, smart. Well, you just, they all figure things out in a different way. And so he was verbalizing that. So when someone comes in and establishes care with you, with this cleaning, with it being introduced to you, can they come back at Treasure Coast and see you consistently, or is it more clinic-like, whoever's available?
Typically, you can request to see whoever you'd like. Just ask the front desk or whoever schedules your appointments. If it's more of an emergency basis, then your options are more limited, obviously. So if you come in on any given day, like out of the blue, I might not be there. So
Okay.
you went to somebody else. Everyone is very good, though. I think you're in good hands no matter who you see.
No, I would agree with you. And again, while some of them prefer to see a little bit older than 2 or 3 year olds, there's a number that, like yourselves, that are very comfortable and actually kind of play with the kids, so it's a good experience. Do we still have a toy box for them to pull something out of?
As of this morning, yes.
Treasure box. I'm sorry.
Treasure
not toy
box, yes.
Treasure box. And so we've talked about all of those things. The official word for seeing the same person over and over again is a dental home, and you're sort of the Papa Bear of the home. So you work with patients then to help them figure out the priorities and the costs. How long does it take to get a treatment plan underway? I mean, we're pretty busy. So if they come in, they get a cleaning, and you identify that somebody needs to have, say, 2 fillings, both financially and from a scheduling perspective, what's the optimum then? A couple of weeks, a month? Before they can come back in or should come back in?
I can't speak to the financial part of it, but I'd say hopefully within a few weeks that first visit they can come back in for their food treatment.
Well, for most of us, we don't have money sitting on the counter there just waiting to be spent. So for most folks, it's a planned thing to come back. And without a doubt, dentistry is more expensive than medical, and less insurances are available to folks at a reasonable basis.
That's fair. I will say that this is still your health. So sometimes insurance might tell you it's hard to cover X, Y, or Z, but I mean, a problem is still a problem no matter what it costs.
And so you encourage people then, I take it, to work out an appropriate treatment plan with you in terms of what's affordable and what is best priority so that a bad situation doesn't get worse.
100%.
Okay. So we have a number of people I see every day on the street who are smokers. How does smoking impact their general oral health?
As you can imagine, not well. It puts you at higher risk for things like oral cancer. It can dry out your mouth as well, which makes you worse to cavities, and it's If you can quit, that would be ideal. But if you can't, I understand it's difficult. I'm just going to say try your best to brush and floss every day and just come back for regular checkups and see how you're doing.
Well, and I've watched you have a couple of swallows of water, and it reminds me, as you talk about saliva with the gum for teens, it would seem that that same approach, having a wet mouth, not a dry mouth from smoking, could help offset some of the damage that's being done by the smoke inhalation.
I'll say some with an asterisk, in that there's a lot more problems caused by smoking than can solve by just drinking water every day.
Yeah, and I got that, but
it's
a tool in the toolkit. It's a minor tool, so I hear you loud and strong.
Yeah.
Do whatever you can to minimize your smoking routine. And I think about that when people say, well, I don't want to put a patch on. What's the difference? Well, the difference is what's going on in your mouth, I would guess.
Absolutely.
Okay.
That's setting aside like emphysema, COPD, cancers.
You got it. So as you can tell, our dentists really have the gateway understood between what goes on in your mouth and what happens in the rest of your body. And so they're a very trustworthy resource for all of us. If you had just another minute, what would you say is the most important thing you want people to remember from our conversation?
I'd say establish dental home as soon as you can. Make sure you're coming back regularly for appointments, and don't wait till it hurts.
Perfect. Now, not to ignore pediatric dentists, okay, because they have a special place in a lot of people's hearts as well. And we are fortunate to have some very good pediatric dentists here in town. Do you ever need to refer to them and or flip it around? Is there any reason why a general dentist who's comfortable working with children would not be able to see children?
So, as parents are probably aware, some kids will not tolerate sitting in a dental chair or anything. And at that point, it's going to require a specialist.
Okay.
However, kids that are responsive to adults telling them to stay open or brush or close, and who can tolerate a visit with a normal dentist, that's great for us.
Thank you.
Yeah.
Thank you. I appreciate that definition in terms of advising parents and grandparents, because sometimes there's a little confusion between general dentistry and specialists, whether it's an oral surgeon or a pediatric dentist. And so I do appreciate that. And so we're going to come back another week with another different, not health-related situation in our guest. And I would invite you to stay tuned. One of the things that is happening here during March is a lot of activities, a lot of events are taking place, a lot of fun things to do, and we'll be trying to keep you advised of all of those as well. So again, I thank you for being with us today and hope that you'll join us every week. And I hope, Dr. Omar, you come back. We'll give it a couple of months because we have a lot of people who raise their hands and say, we'd like to be a part of your show so that we can inform this wonderful community of all the things that are going on. So thank you very much.
Pleasure.
And thank you for being with us all the way to the end. And have a good evening.